I'm doing relatively well, all things considered. I'm glad that, I could come on to your Canada Focus show and be a cautionary tale as to
This
what can
this is
happen to your healthcare system.
this is exactly where we're leading, right? We are going to get into that topic of the day, but I think it's really important.
Yeah.
But like, can you give us just a quick overview? I know,
Yeah.
it's a lot, but just an overview of what this bill
No, yeah.
entails.
I'm happy to try and do that. Now, this big, beautiful bill, it's this incredibly huge, sweeping tax and spending law that President Trump in the beginning of July put out there. And it touches on almost every aspect of
Right.
domestic policy here, from, I think you touched on it, taxes on tips, car loans, to giving $150 billion to ICE and
Yeah,
border
military
enforcement.
increased spending. Yeah,
And of course,
bizarre.
the thing that is concerning mostly to me is that it also includes massive cuts to Medicaid. So the question is, is this going to streamline healthcare, as the people who are proponents of this bill say, or is it going to be terrible, and is it going to make things more difficult for people who need medical care and access, and therefore clogging everything else downstream for everyone else in the country as well who needs medical care? And my thought, you probably can already guess, is that it's a terrible thing. And there's a lot of people here who are against this. I am one of them. And the cuts to Medicare, Medicaid, and the changes that are going to happen to loans to people going into medicine. There's so many aspects of this that are going to really hurt, not just immediately, although it will have effects almost immediately. Even though
Right.
the bill doesn't go into effect in a year, lots of places that rely on Medicaid are already acting ahead of time to prepare for
Right.
that. So hospitals are starting to shut down, and that's only going to get worse.